number of cases so far. It's hoped that a government's collaborative measures, including social distancing, will help curb the spread of COVID-19. Gauteng Health MEC Dr. Bandile Masuku joins us now to discuss how prepared the Gauteng Health Department is as the number of those infected with COVID-19 increases. Dr. Masuku, thanks so much for speaking to us this morning. Welcome to Morning Live.
Good morning, and good morning to your viewers, and thanks for having us on your show.
Dr. Masuku, perhaps if we could just start by reiterating the number of cases that have tested positive in Gauteng. What are the latest numbers?
We were still around 366, and we were waiting for another number of people that we need to allocate into districts of 110. Because we've got a bigger problem of people who've got test results, but we don't have where they stay. They are actually physical address. So it becomes difficult to even announce them before that, because we need to be able to allocate them to different districts across the province.
So how does that come about, Minister? Because it speaks also to the testing protocol. How are people tested and yet you don't know how to get hold of them to give them their test results?
It's anxiety that we've been having with the private laboratories doing the test and even private GPs doing the test, because now it becomes a process that becomes unmanageable. We rely on them to be able to give us correct information on the forms and correct information on their results. So now the problem is that we have the results, but we don't know where physically they stay. So we have to get used to use other means, and we have been able to get help from telecos, from your big telecommunication companies who have been able to help us to track down most of them.
So, MEC, does that mean that this is also part of the delay in the release of results, the update of those numbers? Because are you able to actually update the numbers without informing people of their personal test results?
It's only fair and ethical that we have to inform them first before we even go live in announcing their, as them being part of the statistics. So it becomes a very big problem. We're a bit anxious, and we did express our anxiety with the private labs, with the private GPs, and we just need to find a way with INECD to help us to get through this process of making sure that we even validate the actual results. You will remember that the minister had initially given us some results in Free State, and he later on had to apologize and withdraw those results. This is part of our bigger anxiety, because it just hampers us to be able to do quickly and rapidly enough the contacts, actual contacting the people who have been exposed to people with the virus.
So how much of a setback is this in terms of releasing results? How big is the delay, perhaps expressed as a percentage, MEC?
The bigger delay now, it could be around 5 to 10%. But remember that we have to work with accurate numbers when we deal with this. And we have promised the nation and the country that when we release the results, we are going to release accurate and precise actually numbers every day.
MEC, please give us an update on the condition of people who have tested positive for the virus in the province and are currently being treated.
Yes, from our previous discussion, you'll remember that we didn't have many of them in our facilities, and currently we've got 5 in the whole province who have been hospitalized, and most of them, which we are happy with their recovery, they are not badly ill. They are not in ICU. We had one gentleman in one of our facilities who was not quite well over the weekend, but we did go on Monday. I went to see them, and the team that is taking care of him is out of ICU, is out of high care. So we're actually even preparing for a point where by the weekend he would be able to actually get home.
And then, given that the first case in South Africa was actually in KwaZulu-Natal, some people are still struggling to understand, and perhaps this is an opportunity to give an explanation as to why and how Gauteng now has the biggest number of COVID-19 cases. MEC?
The issue that you have put across in your intro, it's quite accurate that we're one of the highly populated province. And it also just makes sense that we might have to have a lot of infections. But again, we've got a very big airport, which is our point of entry, which receives a number of our airlines from different parts of the world, which is a bigger problem. And the other issue is that we've got Pretoria, Tshwane, which is the diplomatic capital of all the embassies. So most of the traveling diplomats and everybody, they also land in our airport at OR Tambo. And this is a big problem for us because it just continuously increases the numbers of people who are coming back. And it means we must do more again in our actual port of entry.
So you spoke earlier about 5 people being looked after at our facilities, as in the public facilities. And yesterday, MEC, you spoke about beds, ICU, high care and self-isolation. But can you just give us a sense in terms of the readiness of each of these facilities?
We currently have got over 120 ICU beds. We are in a process of escalating the number to reach 300, which by tomorrow will have actually gotten that. We also have got access to some private hospitals, which they offered us their beds in terms of high care and ICU. As we said, that we are continuously increasing and escalating our plans to make sure that when we need those beds, they will be ready. And since we have also scaled down a lot of our operations, general operations in our facilities, it has helped us to create even more actual space for ICU and high care.
And of course, touch wood, you may need them because there's still a lot of face-to-face contact. People don't seem to be heeding the call for social distancing in a meaningful way, and this despite numerous calls being put out. And that, of course, brings up concerns that many more people may find themselves infected who still haven't been tested, but they may be contaminated. Are you concerned about a spike in the number of positive cases at some point here in Gauteng, MEC?
Yes, but remember, some of them we usually have anticipated them, because our results they even indicate the number of contacts. So the most important thing that we need to do during this period of lockdown, which we really ask for the indulgence of our citizens, that they must just heed the call of lockdown and limit the movements. Because the more we move around, the more the virus will also move around. So we are just concerned about it, and we need to do something. We have spoken with the security cluster yesterday that maybe today we might have to have a tighter control on the parts of our borders, particularly our main roads that leads to other provinces, just to make sure that we limit the movement and enforce the lockdown, as it were.
MEC, you also mentioned tents that have been erected at Charlotte Maxeke and Chris Hani hospitals. And just talk to us a bit more about exactly what purpose those will serve, because there is, of course, a perception from the general public that the general conditions in these hospitals actually leaves much to be desired. So what's going to be different about these special facilities that are now being erected during this dire situation?
Okay, the tents we're talking about, they're just for triaging. It's almost like a reception area where we're going to separate the patients who are coming into the facility, into our hospitals, particularly for emergency care. So those who are coming in with respiratory symptoms, like your flu symptoms, they will be put aside and they will be worked up outside. And then when depending on their clinical condition, it's either they get admitted or they are sent back home for self-isolation or for isolation, because we are also we have already started providing isolation and quarantining facilities for those who can't self-quarantine or self-isolate. So those tents are not for admission purposes. They are just reception areas, which we call them triaging areas, where we separate patients and be able to work those who we suspect to be COVID-19 actually positive to be dealt with outside the facilities before they even enter our facilities. They only enter the facilities on the behest and the assessment of a clinician.
And with regard to the number of doctors that you have, do you have sufficient medical staff to deal with these situations? Former Cuban student Dr. Matsobane Molomo, based in Pretoria, he says that they've been appealing to government to actually allow them to come in and assist, but to no avail. So are you well equipped in terms of human resources in this department, or will you need more healthcare workers and caregivers and volunteers, as has been the case in other countries like Italy?
Yeah, I think Dr. Mlomo have to contact us directly so that it doesn't make appeal on the media or anywhere else. Our district office is available to take care of the issues that relates to actually the volunteers. But again, because we are scaling down our operations, most of the doctors, even those who are specialists in other areas, they will be on standby and on hold to assist our casualty officers to make sure that they are always available. So all our doctors in the province who are under our employ, they are actually available to assist in this actually pandemic in terms of the response. We also had a discussion yesterday with SAMA, which they've also indicated that they will be part of those people, a cohort of people who will volunteer. So even the GPs that are operating and private specialists who are operating in the province, they are available. We are finalizing the roster and also finalizing the code that because it's a disaster, they will receive calls from us, from the central command, where they will be told where to go, where they need extra hands.
And speaking of SAMA, the South African Medical Association, they have also made a call that they would like to know where the specific cases of people who've tested positive for COVID-19 are, as opposed to giving a general locality like Gauteng. They would like to know exactly where, because they feel that that would better equip the doctors, the physicians, to deal and be more alert of possibilities of COVID-19 cases in their location. So did you discuss that particular matter with SAMA as well?
Yes, we did, and I think if you have listened to most of our reports now, we are reporting the areas which are hard hit within the province, and you know that we've got 5 districts, and the central one, Johannesburg, being the biggest with infection, and we're also having the Ekurhuleni, which is in the east of Gauteng, where we also have got a bigger chunk. So now we have started to actually give a report as per district to make sure that our response also is also focused. It's not a general response on all the other areas which are actually of low risk.
And are all districts in Gauteng affected, or are there any at this point that still remain unaffected?
Yesterday, we got the first patient who was found to be positive in the area of Sidibeng, the Vaal region area. And so we are now tracing his actually contacts, and it's something that we are actually looking at. West Rand is also one of the lowest hit in terms of numbers. They had 2 patients, and with 11 contacts, where we've already made contacts with all of those actually people there. So we are, in a sense, doing quite well. Though we are a bit anxious, because when the numbers get added, it means we add more contacts, and which we need to actually able to trace.
And of course, one of the concerns has been for a long time what happens when we start getting positive cases in the more densely populated township areas, MEC. And yesterday there was a rumor at best, and that's how I can characterize it, about at least one person testing positive in Alexandra Township. Are you aware of that? Are you able to dispel that particular call?
Yeah, it's a rumor, and I think it's something that we also have to make sure we quell. In our last discussion, we did talk about fake news and fake reports because that also just exacerbates the panic. So in those areas which we know that they're highly vulnerable, and the work that we received, GCRO, which is the Gauteng Observatory Research Unit, gave us these areas where they are the most vulnerable in terms of food security and also in terms of the transmission of the disease. So we have put in measures in areas like that where we are going to have different testing facilities, like a clinic, which will only be dealing with testing those who still meet, the case definition as it is, that you should have been exposed to somebody who have been exposed to the virus and who have got a positive travel history. So we still are going to do that. It's a worrying factor that people continue to do that. And one other person who said it over a radio in Soweto, the place is closed now, and we have been able to follow up all the contacts. We have been in touch with him, and we are just following up on his results now to see if he was actually telling the truth. But I think if he's not telling the truth, the justice system must come in and be able to deal with such people who spread false news and false reports.
So just to bottom line it, so there are no positive cases of COVID-19 in any of the townships in Gauteng?
They are all suspected, as like I've said, they've been reported and they are not have been yet confirmed.
All right, we'll leave it there. Thanks so much for your time this morning, Gauteng Health MEC Dr. Bandile Masuku, for talking to us about how prepared the health department is with Gauteng having the highest number of people so far with coronavirus. And that was Gauteng Health MEC Dr. Bandile Masuku.